A warm welcome to all our viewers to our series Natural Medicine. I have a very special doctor here today whose reputation has long preceded him. I personally have heard his name 25 years ago already, through the world-famous clinic that he ran then. But regarding our topic today, it was always said, before you were treated by my guest, you have to look into your mouth first, because up here are the really big foci, which can really contaminate the body. I would like to hear that again today because he is actually a guest today, here on our station. I'm talking about none other than Professor Dr. Thomas Rau. Stay tuned, we'll get started right away. Here we are again, and now I'll show you the guest. Here is Professor Dr. Thomas Rau, welcome. You were certainly one of the first physicians to include these causal connections in minute detail in a therapy plan, that there is a causality between the teeth and the body. Is that right?
Yes. The thing is, I didn't invent it myself. On the contrary, there were the really big dentists and doctors Volkmer, Kramer, Dornderer, and so on. They are unfortunately no longer known today. Some of them are already deceased, but they did the pioneering work. And there was a doctor, Professor George Meinig, that was the Pope in our scene. Unfortunately, he also passed away recently, at over 90, and he has done huge scientific work on this subject.
Riesige wissenschaftliche Arbeiten über diese Thematik gemacht.
Anyone who still says today that the teeth do not have any influence on the body, or even more stupidly, amalgam does not affect the body, is not toxic, or root canal treatments would not have any long-term effects on the body, they are simply not up to date with the current state of science.
Keine Fernwirkungen auf den Körper machen, die sind einfach nicht auf dem heutigen Stand der Wissenschaft.
But that's standard knowledge, what I'm hearing now, that there are no causal connections.
Yes, unfortunately that's still standard, because biological medicine usually ahead of modern academic medicine because there is a lot of exchange, there is also a lot of research, or, above all, gained experience.
Ausgetauscht wird sehr viel auch geforscht oder vor allem auch Erfahrung gesammelt.
That's why it's sometimes called empirical medicine. But these connections are really proven.
Zusammenhänge, die sind wirklich belegt.
Professor George Meinig wrote a book with over 1,000 bibliographical references.
Das sind nur über 1000 Literaturangaben drin.
So a brochure in which he simply made all the bibliographical references. So a huge amount of knowledge was summarized. But not only from him, there are a lot of doctors. So I'm going to assume that this is scientifically proven.
But it's actually sad that science doesn't prevail, so that we actually have a medicine which reflects science.
Yes, I keep getting into this situation that polarizes. That's what academic medicine should be, and that's not good at all. No, we have our strength, they have their strength. And we should work together. For the teeth and the connections between the tooth situation, jaw situation, to put it a bit broader, an entire body, we're just ahead. I really have to say that because we connect that. And I see today, now we're actually getting to the topic, I see today how tooth foci, that's what we call it, and toxic loads from the teeth, how that can have a long-term effect on the body. A long-term effect, a disease-producing effect that comes from the teeth. You said earlier, yes, he's known for looking everyone in the mouth. Yes, honestly, there comes another topic. I'm one of the few doctors who still knows how to physically examine people. I examine my patients. And more, it's sad, I get the comment, oh, you're still examining me.
That's online today, isn't it?
Yes, it's all online. And you need the diagnosis, and then you have the book of the guideline treatment, and there is no longer any need for an examination. The doctors, unfortunately, only do auxiliary examinations such as computer tomograms, magnetic resonance scans, MRIs, and so on, send people down the tube, as they say, or do laboratory tests. It wouldn't be necessary, I mean, in most cases, not necessary if you were to examine people. And so I also examine people for dental foci. I'm not a dentist. Sometimes I say I'm actually a dentist who doesn't drill. Because I have so much to do with teeth as a cause of diseases.
I've had Dr. Lechner here in the house and we talked about Rantes. And now I know, for example, Rantes has more than 8,000 publications in academic medicine related to rheumatism. Now I ask myself, why does no one look in the mouth, where the greatest potential for triggers is in connection with rheumatism? Breast cancer, 6,000 studies. Prostate cancer, 5,000 studies. But nobody actually looks in the mouth here. So why is it known that Rantes is related, but why is there no established medicine, which then goes looking for Rantes? Where are the foci?
Because it's not taught in the university yet. And also, yes, that's really sad, Dr. Johann Lechner, a great role model in the dental scene, a dentist. So the greatest respect for my colleague Lechner. Of course I know him personally. My highest respect. And he researched that. And anyone who says that is not true is simply an ignoramus. Whoever still claims today that tooth root foci, which leads to a cytokine immune response, namely Rantes, would have no effect on the body, they are ignorant. They should just read the studies. Sorry if I'm so direct and honest. You can't say that anymore today. That's like saying smoking doesn't harm people. Yes, then I would be an ignoramus. And so it is with the Rantes. Or with heavy metals from the mouth get into the body and can subsequently toxically burden the body and produce chronic diseases or even acute diseases. Neurological, autoimmune, cancer diseases. I did tests. We used to do breast cancer tests in the clinic that I used to run and set up. I'm treating autoimmune diseases. And cancer is actually my strength or my main field, so chronic diseases. And we always took the teeth into account. And then I looked, what about breast cancer and heavy metal pollution? What about breast cancer, because I was allowed to treat so many breast cancer patients? And what about root-treated teeth? And we found a clear connection. I then started with breast cancer patients who came with breast cancer. Now I have to have an operation on the breast, remove the cancer, which of course is good and important to ask, can't we also make a toxicological diagnosis instead of just a histological one? Check the tissue for heavy metals, which can cause cancer.
You don't do that?
No, you don't do that.
A biopsy only looks for cancer?
Only the histology is done, but the cause, namely the toxic load, is not examined. And we did that once. And we saw that the toxins were stored in the breast cancer tissue. Up to, the highest value was compared to the healthy tissue, 30,000 times higher concentration of mercury. We only tested mercury at the time. So the cancer stores these carcinogenic substances in itself.
Krebserzeugenden Stoffe in sich. Ja,
Why are there relapses in cancer patients?
bei Krebspatienten?
Because you don't treat the cause. That's why it's my duty as a responsible doctor to see where the causes could lie. And they can be in the tooth area. Simply not taking this into account is negligent.
I recently did a show with Lothar Hirneis. I watched it again this morning, listened to it while driving. And I saw again that there are so many studies that a cancer cell stores such toxic loads. It evolves to catch this dirt as a landfill. And then I got a completely different understanding that the cancer cell is actually not a curse, but a blessing of the body. To get hold of this rubbish. And it has an incredible number of options. A cancer cell can absorb much more waste than a healthy cell. And then I thought, my God, the body is so smart. But we see the cancer cell as the enemy. But it grew in us.
It's just unfortunate that the cancer cell also becomes independent under this toxic influence and no longer follows the interests of the body as a whole. It's like a terrorist, so to speak, who suddenly has absurd thoughts and works against the state. That's the problem.
But before that, if you already know that there are toxins in it, chemotherapy can now inject even more toxins into the body, or you see that you detoxify the body.
Exactly. That would be a different topic then. Let's stay with the dental foci. But I totally agree with you. Great respect also for my dear colleague Lothar Hirneis, who discussed this with me 20 years ago or even more. There was Hans Heinrich Reckerweg, who was the basic thinker in our scene, so to speak, the founder of the Hell Company, who believed that the cancer cell was, so to speak, a last attempt by the body to detoxify the body and store the toxin in itself. It's just stupid that it then becomes autonomous. All right, back to the teeth. There are three main problems that we find extremely common in the patient's dental status. First, the metals. Secondly, the toxins, which are produced by dead or artificially killed root-treated teeth. And third, the temporomandibular joint problem. This is much more taken into account in America, namely all the osteopathic relationships between the temporomandibular joint. I would ask Dr. Mazetta. Kurt Mazetta is one of the main exponents of this topic in Europe. What do the temporomandibular joints do to the body? If the tooth position is wrong due to incorrect dental treatment, then there is tension. And this tension can lead to neurological problems. Temporomandibular joint. Second, and this is what we can do, is testing whether metals release metal ions in the body. If you have amalgam fillings, then they can be extracted. And they can be extracted over decades. And the smallest concentrations in the lymph can produce toxic phenomena in the body. This is highly toxic. And it's criminal that that's still allowed to be given to a person today. That should no longer be given because it is known.
But as far as I know, in Germany, for example, the insurance company pays for dental treatment so that mercury is free. If you want ceramics, you have to pay the surcharge.
Exactly. It doesn't even have to be ceramic. It could be the modern plastic fillings, composite, the adhesive plastics, which also do not emit any toxic or only slightly toxic ions, much better and not even more expensive. But you can't rely on Germany's official medicine if you want to think progressively. Unfortunately, they are totally behind. In Denmark, in Norway, as far as I know, in Sweden. These are the more advanced states where amalgam is no longer allowed. And they thought about it too. Degasser, the company that made amalgam, got out of amalgam making, a multi-million-dollar business, because they probably feared that they would eventually have product liability and then have a lot more costs. There's a reason if the main amalgam company stops producing these substances.
Then it will be banned. Glyphosate will be banned in 2025. Until then, it's still healthy.
Exactly. It's being used at ever-increasing levels while it's still usable. DDT, by the way. This pesticide was banned in 1992 throughout the Western world. However, consumption increases because it is simply used in Africa. The Chinese use this extensively to produce corn there to feed their pigs. The pigs are exported to us.
Exactly here I thought there should be a comprehensive liability. If a Swiss company sells something that is prohibited in Switzerland, based on the available data, and you still sell it to Africa, then I think it's a huge mess ethically and morally. Let's go back to the teeth.
The sovereign voted on that.
And we don't even want this liability anymore. If the money is somehow there in the market, then that's really sad.
Sorry, Alexander. We can talk about whatever we want, but we keep coming back to such despair. Why isn't that changing? Why don't we look? Dear patients, take a look at your health yourself. Find out where toxins can be. Go to doctors who know about it. Holistic doctors or naturopaths. Make sure you get your information. In today's world, people have to take responsibility themselves, because unfortunately many responsibilities are not taken. That's really sad. And so it is with the teeth. When I look at my patients, it's so simple. I can see in 20 seconds or a minute, it's root canals, which can be highly toxic. Then I have to do an X-ray to see if there is an immune reaction to these toxic foci or not. A panoramic X-ray costs about 150 francs with us. That's not a huge cost. Then I can say that. Then I continue to see if the patient has metal fillings. In a minute, 2 minutes, I can test this metal filling in the mouth with electrons, whether they give off ions or not, whether a galvanic current is produced. I can test these physical disruptive factors. It's very simple, but you have to do it. I can tell people you got foci. You have to remove this tooth because the immune system is already reacting to it. Or they have metal fillings, it can be gold, it's really bad with palladium, it causes depression, that creates cognitive problems, that creates Parkinson's. Or they have mercury where the mercury is constantly leaching out.
And destroys the body.
That's incredible. Every doctor should actually do a very simple examination in their practice.
I did 2 experiments. I also had amalgam fillings myself. I sent my spit to the lab and was told that this water solution should not be dumped in nature, because it violates the groundwater ordinance. I figured, well, I have it in my mouth and swallow it every day. The second was with the galvano current. I also had 2 different alloys. I put an LED lamp there in front and connected it. My LED lamp lighted up.
Exactly. Gyroscope gear loose.
Very simple. These experiments show I have a battery. How these galvanic currents affect the even finer cerebral waves is completely unstudied.
We take measurements every day. This is not uncommon. No, I see that once a week with 100% certainty. When I measure patients' galvanic currents, it moves in the milliampere range. But the brain currents are in the nanoampere range. That means currents take place which are 100,000 times higher than the brain currents. It is no wonder that this can eventually lead to neurological symptoms.
But it is just said, there's no causality. Then we are all happy again, because the doctor in the white coat told us that there is no relevance, no causality. Back to the teeth. When you pull a tooth, then I still have the roots that are there. These roots are no longer attached to a tooth. The roots begin to decompose over time. But I always have the problem. Can this be solved?
The holistic dentist, when you pull a tooth, then they pulls it with the root and then decontaminate the hole. We even do it by roughening the wall of the hole. Don't worry, it doesn't hurt because it's anesthetized. And then these platelets released growth factors, these growth factors from the patient's blood. This causes this hole to fill up with bone within 6 weeks. Then the focus is gone. When done properly, the focus is truly eliminated.
Perhaps to conclude by showing a connection. What are the consequences? What could possibly be the consequences of serious illnesses that were actually triggered by the toxins from the oral cavity? You said Parkinson.
The most common diseases related to the mouth are local. Chronic sinusitis in young people. If you have chronic sinus infections, it's dental problems. In over 80%. It's just bad that the ear, nose, and throat doctors don't look at it. Secondly, as they get a little bit older or in the longer term, there are allergies. The immune system is altered by nickel, mercury, and cadmium in such a way that allergies can occur. Third, and now comes the fatal stories, tooth lesions can be the cause of neurological diseases. Tremor, for example. Very classic, often together with tooth foci. And I think something most common is tinnitus. Tinnitus is a dental disease. Well, of course it's absurd when I say that, but I have tinnitus very, very often. Heavy metals or toxic metals or dental trouble foci. The ear is so close to the TMJ, it's a centimeter or two away. So unbelievable these connections. I usually treat rheumatism and cancer. Cancer patients and rheumatological or autoimmune patients. We see connections all the time. For example, the patient tells me, well, the tooth always bothered me after the root treatment. Yes, I'll look at it then. I see that the root-treated tooth is dead, has been infected, and the body is already trying to encapsulate this tooth with a granuloma. I remove the tooth and the rheumatism is gone. I often have such things, or epilepsy. I'm not saying epilepsy is because of dental disease, but I often see epileptic patients and especially neurological patients, which improve significantly with the dental rehabilitation.
Epilepsy, just a quick keyword. I saw a patient for the first time last week. In fact, if you came 2 meters near him with a mobile phone, he was just shaking. He lay on the floor. Then you walked away again and he was fine again. So this relevance, this causality, which I have seen. Cell phone radiation, epilepsy. It was so bad to see how he is suffering because he no longer knows where to go because he is reacting to this interference field. This about epilepsy, that's terrible.
I have to say something very brief about that. This is of course a very bad case. But one has to ask oneself, causal medicine, why is this person so sensitive to this radiation? Couldn't it be that other factors are also irritating his nerve cells?
Yes, probably toxicological again, right?
Again, toxicologically, or a lack of stabilizing substances that humans need, such as chromium, lithium, and selenium and so on, which stabilize. Or the good oils, the fatty acids, which stabilize. So I think this person could be helped.
Yes, I think so too. What more can I say? Many thanks, dear Professor Dr. Thomas Rau, for this enlightening broadcast. Once again a top show. And for you too, dear viewers, what do we actually want to achieve with this show? Nothing other than sensitizing you to questioning whether there could be anything in your mouth area that might be responsible for your condition. And if you are only ever with the doctor and they only look selectively or organically and do not recognize these causal connections, then you can of course tinker around for decades without it getting better. Therefore, my call to you, if you have such problems, to involve a holistic doctor and to ask them to simply include all these connections from the oral region in the analysis, and to see whether there is a need for action, so that afterwards it is really treated at the cause and its effects are ultimately allowed to disappear.
Ob man da allenfalls Handlungsbedarf hat, sodass es nachher wirklich an der Ursache behandelt wird und ihre Wirkungen letztendlich verschwinden dürfen.
That was the point of the show, and that's your great pioneering work that you've really nurtured and cherished for 25, 30 years now, and I even heard it from you, and I know that very many doctors are already using it these days through your education and through your reputation that has preceded you. Thank you very much. All the best and see you next time.